Dr. Srinivasmurthy from Bangalore. I'm talking about diabetes and COVID-19. As we know, all of us in India especially are undergoing this lockdown, and we're all keeping the physical distancing and continuing with the lockdown. And we should know some background why diabetes is management is important during these episodes of this pandemic. So we know diabetes, we are the second to China when it comes to the incidence of diabetes. And this coronavirus, WHO has declared us as a pandemic. And at this juncture, we should be aware because as of today, we have 10,000 plus patients in India. And there are certain states which have crossed 2,000 also in the incidence. Just to give you the importance or the seriousness of this disease, this is I'm talking about up to April 8. Up to April 8, there were 86 people who died in India because of COVID-19 infection. And in this, 56% of them were diabetics. That means out of 86, more than 40 people, 45 people were diabetics. So that is very, very important. And over third of these 86, that means about 30% of them had both diabetes and hypertension. This is the commonest comorbidity associated with this COVID-19 infection. And we know the fact that about 9.54% of Indians are diabetics, and that is a burden we have. And of course, irrespective of the age group, people are getting affected with this. So do not think just because you are 40, 50 years, you are safe. There is incidence of death even in this age group of 30s and 40s. So who is at more risk? Definitely people who have cardiovascular disease, people who are diabetics, hypertension, and chronic respiratory diseases. These are the high risk individuals, what we normally divide them as a high risk category of group who can get this infection and succumb to infections very fast. But remember, worldwide, diabetes was present in about 42% of the patient fatalities this is the China data which I'm talking. So diabetes, 42% of people who died because of COVID-19 infection in China. And diabetes was an important risk factor for mortality in the patients who were infected with COVID-19. Very important factor to know. In fact, even earlier when we had H1N1, SARS, or MERS, MERS, this diabetes was the key factor for mortality in patients. And worldwide, the first 3 deaths in Hong Kong all were diabetics. Just to tell you the seriousness, I'm again reinforcing the incidence of diabetes and the mortality associated with this disease. Very, very important factor. So in another studies, they analyzed about 25 deaths. Out of these, 60% of them had hypertension, 40% of them had diabetes. So diabetes, hypertension put together, that is what we see in our routine practice, the commonest individuals, patients we see in this risk group, and most of them are 50, 60 years old. So very, very important, and diabetes should be considered as a risk factor for rapid progression and bad prognosis of COVID-19 infection. And also remember, there is something called case fatality rate. The case fatality rate without diabetes is 2.3%. Whereas just because you become a diabetic, the case fatality rate can increase threefold. That means it goes up to 7.3%, whereas in hypertension it is 6%. So hypertension and diabetes put together, you can imagine the amount of risk what we face. And in type 1 diabetics, there is no extra evidence to show that these people are more prone to develop. If your diabetes is well controlled, definitely it is not going to give you more of risk. So we need not panic just because we are diabetics and we are hypertensives. Our patients, we can definitely treat them, keeping them under good control. So what is the message? If diabetes is well managed, the risk of getting severely sick from COVID-19 is about the same as a general population. So remember this. If your A1C is 7.5, then you are in a safe zone, I would call. Because in general, you see A1C goes more than 9%, the mortality for pneumonia, the respiratory related illnesses, becomes more, hospitalization becomes more. So 9% is A1C. So somebody's sugars are well controlled, 7.4 of A1C, then they need not worry. The risk becomes something like a general population. So all of us, I'm sure by this time, are aware about the symptoms of COVID-19, the simple upper respiratory tract infection. There are 2 papers published from India, the Jaipur paper, and which clearly said the upper respiratory tract infections are more common presenting complaints apart from fever, myalgia, body pains, all this. And remember, there is one more catch that diarrhea, isolated loose motions can be one of the presenting complaints without even having body pains or fever. So that is something we should keep in mind because we are catching up with summer in our country. So that is one important factor to differentiate. Now, Why diabetics are more prone to develop these infections or complications is obviously diabetes is a immunocompromised condition, we call it. That's because of the impaired neutrophil chemotaxis and impaired phagocytosis. There are other mechanisms in diabetes now proposed because of this COVID-19, why people get infected or mortality is more in diabetics because of increased ES2 expression, increased furin levels, impaired T cell functions, and increased interleukin 6 levels. These are some of the other mechanisms contemplated, and this in fact interleukin 6 is related to the cytokine storm what we are all contemplating. So metabolic syndrome, obesity is also important. So all the bodies, ACE, ADA, IDF, including RSSDI, we have issued guidelines for patients with diabetes, for physicians, healthcare workers to treat diabetes. Those simple points is, remember to continue to take your medications. Do not panic out of stock all that, because the medical stores across India are open. Do not panic. There are pharma friends who are helping to reach out, like insulin, example. So do not stop medications. Do not take alternate. Do not take half tablets. Please don't do this. Number one. Number two, refill your prescriptions in a timely manner. Do not give excuse of this quarantine or lockdown. You should arrange, make sure your stock is available enough for you to handle, and stay home as much as possible, especially diabetics and hypertensives and above 60 years are high risk group. Very young is also high risk group. Wash your hands with soap and water repeatedly, at least 20-30 seconds when you wash. That is what will kill the virus. Easiest, simplest, and when you cannot afford to wash your hands with soap and water, the sanitizer with more than 70% alcohol is something which you can do. Cover your nose and mouth both. I see a lot of people, including paramedical people, covering only the mouth and leaving off the nose. So please do not do that. There is a recent report which has showed even 13 feet away it has spread. 13 feet, remember. So we were talking about 6 feet all these days, but there are some incidences, reports which have shown clearly that in up to 13 feet, people can transmit infection. Avoid touching your eyes, nose, mouth repeatedly for whatever reasons. And it is a fomite spread. That is what it differentiates between your H1N1, SARS, and this infection, that your doorknobs, your calling bells, your mobile phones, your TV remotes are the ones which can transmit. And whenever you feel sick, that means it can be a simple allergic rhinitis, upper respiratory tract infection. Please report to the doctor at the earliest and take appropriate treatment, or if required, fever clinics, what the government has set up in across India. So this is what we should do, and this is what we should advise to our patients. This is in general, most of the guidelines talk about. And the lab reports, of course, CBC, lymphopenia, reversal of neutrophil lymphocyte count, more than 3.3 gives a worse prognosis. All these are routine, and that doctor will take up when it is to be tested for which patient. Do not panic and don't go voluntarily and test it. That is what a lot of patients ask us, that please do not advise them to check voluntarily. And for type 1 diabetics, there is no extra. Sick day rules apply. Type 2 diabetics, they should continue with their oral medications. If they develop infection, if they are mild, they are asked only for housebound, stay back, quarantine, then they need not change OHS. Otherwise, please stop SGLT2 inhibitors and metformin when you become moderate to severe disease. That the doctor will definitely advise you. Insulins are the drug of choice during any infections, as we know. And even now, insulin definitely will. A lot of patients may require a basal shot, because nowadays people, because they are homebound, they tend to do less of physical work, and they may eat more also calorie wise. So cut down calories, eat small frequent feeds, eat more of proteins, and in your diet, cut down carbs, no direct sweets, keep yourself well hydrated, at least 30 minutes of exercise in the house. Just simple standing exercises can be done just like a drill. You need not go for a walk. This is what one of the commonest questions asked, because of the physical distancing and lockdown, they're not able to go to their parks, etc. But you can still continue to do exercise at home, take your medications regularly. Any problem of hyperglycemia or low sugar, high sugar, both, please contact your doctor through proper channel, and stay back home and stay safe. Thank you very much.